All right, so let me share my screen and we'll get started. Okay, getting a thumbs up. Hopefully that means it's showing properly and everyone is full screen. Okay, so yes, again, today's class is Health and Safety for Caregivers Special Topics. The New Mexico Caregivers Coalition is very thankful that we get to bring this class and training to you all at no cost to you, thanks to some funding by the Occupational Safety and Health Administration and the U.S. Department of Labor. They cover the curriculum that we've created and the tuition that this training would normally cost for everyone. So we like to always give a shout out to them for providing us with that funding. A quick overview of today's agenda. So we'll start with introductions and a pretest. The pretest is not graded. It sets a baseline for us to know what everyone is coming to this class with, which information you may already know. And then at the end of the class, there will be another post-test. It'll be the same set of questions. Regarding topic matter, we're going to start with chain of infection, which is also known as the cycle infection. Those terms are interchangeable. And then we'll go into respiratory syncytial virus infection, RSV for short. There will be a 10-minute break. And then after the break, we'll return with monkeypox, workplace violence, and sexual harassment. And there'll be a second 10-minute break. And then we'll return with workers' rights and responsibilities, enforce the workers' safety. And then we will conclude with the post-test. Again, the post-test is not graded. It'll be the same questions you took at the pre-test. And then we'll end with a session evaluation. So first things first, we are going to now do the post-test. The pre-test, mixing up my tenses today. The pre-test. The pre-test is 9 questions, 8 of which are test questions. The 9th question is to gather some information on whether you are employed or not. This is information that OSHA and the Department of Labor asks that we collect just regarding who's attending our trainings, especially since this training is funded by OSHA, and that is who they cover. They cover workers and employees in the United States. The pre-test is going to be launched using the Zoom poll function. So when I launch it, it'll automatically pop up on your screen. However, we've learned that Zoom likes to glitch if someone is touching their device when I launch it. We're not sure why Zoom does that, but it seems to happen pretty frequently. So I will warn you in a second to make sure you just put your hands off the devices before I launch it, just to make sure it gets onto as many screens as we possibly can get it onto. And you do have to answer all 9 questions before it will let you submit the pre-test. Okay. So I am going to launch it now. So just quickly, hands off. We don't know why, but it seems to happen every time. If someone's touching it, it thinks that you're swiping it away. So quickly, hands off, and I'm launching the pre-test now. All right, I will leave the pre-test up on everyone's screens for about 5 minutes or so to give everyone a chance and an opportunity to answer the pre-test. After 5 minutes, I will ask in case anyone still needs additional time, but I'm going to now give everyone a chance, and I will stop talking so everyone can concentrate on the pre-test. Are there any folks that are still actively working on the pretest? I don't want to cut anyone off. It's been about 5 minutes, but I'm happy to leave it up for a little bit longer if anyone still needs to finish. I know we have a couple folks that the count on my screen is not going to be correct because we have a couple folks that called in. But if anyone is actively working, I don't want to cut anyone off.
No one put anything in the chat there, so.
Okay, thank you. Well, thank you all for participating in the pretest. Again, I like to remind folks it's not graded. We don't want everyone to feel scared about it being graded. It's not graded. We'll take the same set of questions at the end of the class today. And hopefully it'll show you that, just help you to show what you learned through the class. Maybe something you got wrong in the pretest, you nail and get correct on the post test. So, okay. So before we jump into deep diving into all of the topic matter for today, I always like to start off the class with an icebreaker. Just kind of start off with something fun and stuff before we go into all of this discussion about infections and RSV and monkeypox and workplace violence, which I know can be somewhat of a downer. So I like to start with something more fun. So if everyone could, oops, sorry, scrolled past too fast. If everyone who has access to the chat function, if you could just put in something positive that has happened today. So we can start off with some positivity in today's session. And also one thing that you're hoping to learn from today's training. So again, if you just want to put in something positive that has happened today to you, and one thing that you're hoping to learn from this training, just drop that in the chat. I'll leave the questions up for a couple minutes before I move on to the next thing, and you're welcome to keep writing in even after I stop, even after I switch slides. It's just something so that everyone can kind of get an idea, start off something fun, making sure everyone has access to the chat is always helpful. Trying to make sure we can have that access helps us too. So again, something positive that's happened today and something you're hoping to learn from today's training. And I like to note that that's something positive could be practically anything, anything positive that you think. My positivity moment is usually that I have Starbucks because I love Starbucks. So any day that I get to have Starbucks is positive start for me. Thank you to the folks that are already putting some stuff in the chat. Appreciate it. Today this is a large class. I'm so excited how big this class is. We haven't had a large class in a while, so we're really excited to have a large class. I won't be able to read all the messages that are coming into the chat, but it looks like a lot of folks are looking to learn more about RSV and monkeypox and being thankful for their health and not being sick. So thank you all for that. Okay, so let's go over quickly what are today's learning objectives. So hopefully everyone at the end of today's session will be able to describe the cycle of infection, also known as the chain of infection. As I mentioned previously, those two are interchangeable terms. So you'll probably hear me say sometimes cycle infection, sometimes chain infection. It's the same concept. Also, hopefully just demonstrate knowledge of symptoms and transmission of RSV, as well as the knowledge of symptoms and transmission of monkeypox. And then demonstrate knowledge of workplace violence and identify key workers' rights and employer responsibilities. So first off, we're going to discuss the chain of infection. So the chain of infection. Infection occurs when an infectious agent leaves its reservoir or host. And on this graphic here, on this slide, reservoir is right on the left side of the slide in red. That is the reservoir or host. And an infectious agent leaves the reservoir or its host through a portal of exit and is conveyed by some mode of transmission. And a mode of transmission can be any of the middle things there in that giant arrow there. Those are all potential forms and modes of transmission. And it enters through an appropriate portal of entry to infect a susceptible host. So the susceptible host is on the right-hand side of the slide. This entire sequence is called the chain of infection. So it's the chain of infection when an infection agent leaves its reservoir through a portal of exit, transmitted through any form and many forms of modes of transmission, enters through a portal of entry into the new susceptible host. So on the next slide, we're going to go into a little more details of each of these steps in the chain of infection. So the first step in the chain of infection is the reservoir. And the reservoir is the habitat in which the agent normally lives, grows, and multiplies. And there are 3 types of reservoirs: human reservoirs, animal reservoirs, and environmental reservoirs. So let's go into a little bit more detail about each of those types of reservoirs. First off, human reservoirs. They may or may not show the effects of illness. And a carrier is a person with an apparent infection who is capable of transmitting the pathogen to others. However, the one thing that about human reservoirs that is kind of unique to human reservoirs is that reservoirs can be asymptomatic, or what is also known as passive carriers or healthy carriers. And an asymptomatic carrier is when that person is carrying the pathogen, they are sick, but they may not show symptoms of that illness. So they may not actually know they're infected. So that's kind of like a unique detail to human reservoirs, that humans can catch a pathogen, their body can be fighting the pathogen within them, but they may never show the symptoms that actually tells them and tells others that they're sick. So they may not realize that they could potentially be passing that on to other folks because they are asymptomatic. The next category of reservoir is animal reservoirs. And animal reservoirs can be a variety of animals. So there are separate kinds of animal reservoirs. Some diseases can only be transmitted from animal to animal, but there are certain infections that can be transferred from an animal to a human. So that means that humans are subject to certain diseases that may come from an animal reservoir. And if there's an animal that can transmit whatever infection they have to a human, that term is called zoonosis. So the term zoonosis refers to an infectious disease that is transmissible under natural conditions from vertebrate animals to humans. So for example, in this training, we're going to go over monkeypox. Monkeypox is a zoonosis disease because it can be transmitted from rodents and primates to humans. Last type of reservoir is environmental reservoirs. So plants, soil, and water in the environment could also potentially be reservoirs for certain infectious diseases that humans could potentially catch from those environmental reservoirs. The next step in the chain of infection is the portal of exit. And this is the path by which a pathogen leaves its host. For example, pathogens tend to leave its host from wherever within the host that the pathogen is housed. So in the examples there, it says exit the respiratory tract through cough or sneeze. Respiratory viruses like colds, flu, COVID-19, they're all respiratory infections. So they live in the respiratory tract of a human reservoir. And they could leave that respiratory tract through coughing or sneezing. Bloodborne pathogens, things that live in your blood, like HIV and AIDS, could potentially leave the body through open wounds or open breaks in the skin or through blood. The next step in the chain of infection is mode of transmission. And that is an infectious agent transmits from its natural reservoir to a susceptible host in a variety of different ways. And there are three main categories of modes of transmission. The first category is direct contact. And direct contact occurs through skin-to-skin contact, kissing, and sexual intercourse. The second category is droplet spread. And droplet spread refers to a spray with relatively large, short-range aerosols produced by sneezing, coughing, and even talking. And then the last main category is indirect transmission. And there are three subcategories under indirect transmission. The first subcategory is airborne transmission. And airborne transmission occurs when infectious agents are carried by a dust or droplet nuclei suspended in air. The second category of indirect transmission are vehicles. Vehicles are inanimate objects. I'm going to repeat that. Vehicles are inanimate objects, so they are non-living objects that can indirectly transmit an infectious agent. So for example, food, water, blood, doorknobs, light switches, tabletops, things that someone could potentially spread to, and then another person, another human, comes and grabs it from that inanimate, non-living object. The last category of indirect transmission are vectors. Vectors are living things. So vectors are different than vehicles because vectors are living things, such as mosquitoes, fleas, and ticks that can carry an infectious agent. So just to repeat that, there are three types of indirect transmission: airborne, vehicles, and vectors. And the difference between vehicles and vectors is that vehicles are inanimate, non-living objects, and vectors are living objects that can carry an infection. The next step in the chain of infection is the portal of entry. This is the manner in which a pathogen enters a new susceptible host. It's very similar to the portal of exit in the manner that how it left the reservoir is likely the same manner in which it's going to enter the new susceptible host. So someone could inhale droplets from a sneeze or a cough. They could have an open cut on their skin. An infection can enter that way. Or it could enter their mucous membranes, like through the eyes. The last link in the chain of infection is susceptible host. So this is, like it says, the final link in the chain of infection. This is the new person who unfortunately caught whatever infection came from the original reservoir. And the susceptibility of the new susceptible host depends on many factors. It depends on their own individual genetics, their own specific immunity to themselves and their environment, their nutrition, etc. There are a lot of things that affect an individual's ability to resist of infection. So, for example, a healthy 16-year-old boy who's an athlete, runs all the time, eats really healthy, would probably be that have a stronger immune system than someone who's going through chemotherapy for a cancer treatment, because chemotherapy could impact their immunity. So whether or not the new susceptible host is, one, going to show symptoms of being sick, and two, the severity of those symptoms depends on that individual's own immune system and whether or not they can fight the infection that they caught from the original reservoir. And as caregivers, whether you work for in-home care, which it mentions here on the slide, but even if you work in facilities, there are a lot of potential infections that working in a home care, healthcare, etc. environment can lead to. So this list is not all of them. This is just like a general list of potential infections that you may catch. But obviously there are hundreds of potential diseases that anyone could catch working in that sort of environment. But just a quick list include things like RSV and monkeypox, which we are going to go into detail in today's training session. But also COVID, hepatitis A, B, and C, H1N1, hantavirus, colds, influenza, pneumonia, other respiratory infections, and even staph infections like MRSA. Okay, we are going to now transition into a pretty detailed dive into respiratory syncytial virus infection, RSV for short. So respiratory syncytial virus is a common respiratory virus that usually causes mild cold-like symptoms. And RSV season starts in the fall and it peaks in the winter. And most people catch RSV for the very first time as an infant or toddler. So this was a test question. Nearly all children are infected before their second birthday. Again, because most people catch RSV for the first time as an infant or toddler, that means nearly all children are infected with RSV before their second birthday. However, people of any age can be infected, but healthy children and adults are likely to have less severe symptoms if they do catch RSV. But who might be at a higher risk for severe illness if they were to catch RSV? Well, premature infants, young children with congenital heart or chronic lung diseases, young children with compromised or weakened immune systems due to a medical condition or medical treatment, children with neuromuscular disorders, adults with compromised immune systems, and older adults, especially those with underlying heart or lung diseases. As I had mentioned in the chain of infection, these are all things that can compromise someone's immune system, which probably compromises their ability to fight RSV infection. Could mean that they have lower immunity, so they're at a higher risk for more severe illness if they were to catch RSV. What are the RSV symptoms to look for? Well, first, symptoms appear 4 to 6 days after getting infected. So if you catch RSV from the original reservoir, someone else who has RSV, it will take you 4 to 6 days before you start to show symptoms. And the symptoms usually appear in stages and not usually all at once. But the usual symptoms include runny nose, decreased appetite, coughing, sneezing, fever, and wheezing. Again, those are all cold-like symptoms. Infants who have RSV may have signs of irritability, decreased activity, and difficulty breathing. RSV is pretty short-lived infection, though. It runs its course within a week or two, but it is a viral infection. So currently there are no specific treatments for RSV infections, but you can take steps to relieve the symptoms that you're feeling. So for example, if you have a fever or you have a headache, you can take over-the-counter fever reducers or pain relievers such as ibuprofen or Tylenol to help treat those symptoms. However, just be aware that if aspirin is your go-to over-the-counter pain reliever, to not give that to a child if they have RSV. Also, drink enough liquids, fluids, stay hydrated. Staying hydrated is extremely important in general, but it's even more important when you're sick because it helps your body kind of balance itself to help fight the infection that you're going through. If you have any concerns or additional questions, obviously you can always talk to a healthcare provider. It's especially important to reach out to healthcare providers if it is a young child who is sick with RSV, because there are some over-the-counter cold medicines that children are not allowed to take. So make sure that you are giving proper over-the-counter medications to children, especially. And last important note from this slide is I mentioned there are no specific treatments for RSV infections, and it is a viral infection. Viral infections tend to be things that vaccines are created for, so that your body can help kind of have a basis to help fight it. However, as of now, they have still not released an RSV vaccine. Researchers are working on an RSV vaccine. I'm sure it'll come out soon because they did notice the big spike recently, but it's not out yet. But that is half a test question. The test question did ask if the CDC recommends RSV vaccines. Well, they cannot, because it's not released to the public yet. So they cannot recommend that the public get a vaccine that does not yet exist. So what are the modes of transmission for RSV? Well, the first one is droplets from coughing or sneezing, since it is the person who catches RSV will be probably coughing and sneezing a lot. So that's probably the main spread. But it can also spread by kissing any individual who's infected with RSV. This one I always like to mention is most people, when I bring up kissing someone with RSV, they say, well, I'm not going to kiss my spouse or my significant other who's sick, which usually adults can avoid doing that when they're sick. But where it becomes an issue is since RSV is so common among young children, that might be more likely, like kissing the cheek of your child, your grandchild, etc., whether you have RSV or they have RSV. If a child is sick and they have RSV and then you kiss their cheek, they potentially could give it to you as well. You can also catch it from touching surfaces where the droplets landed and then touching your face before you had a chance to wash your hands. This is an important note because, again, since RSV is very common in young children, children don't quite understand how to cover their mouths and noses when they're sneezing yet. And RSV can survive for many hours on hard surfaces like crib rails and tables. So if an infant or a toddler has RSV and they've sneezed on the table or their crib rails, there's potential for their caretaker, their parent, their grandparent, whoever's ever caring for them, to potentially catch those droplets and put them towards their own face. So just being aware of that. However, RSV droplets survive a little bit less time on soft surfaces. So things like tissues or clothing. So if someone does sneeze on their clothes, it'll still be there for a little bit of time, but not nearly as long as if it was on a crib rail. So important notes to make is that RSV is contagious for 3 to 8 days after your symptoms appear, but you could potentially be contagious for 2 days before you even know you're sick because your symptoms have not yet shown themselves. So you could be sick for 2 days prior to your first symptom and then up to 8 days after your symptoms begin. Additionally, though, infants and people with weakened immune systems could be contagious up to 4 weeks after. So they could potentially still be contagious even after their symptoms stop for up to 4 weeks. So now that we know how RSV is spread, what are some steps can we do to take to prevent RSV from spreading? First off, the main thing is always cover your coughs and sneezes with a tissue or your upper shirt sleeve, not your hands. Can anyone tell me in the chat why you want to avoid sneezing directly into your hands? Let's see. Spread germs. You carry the germs, yep, more transmission, because you may not always be able to wash your hands at that time. That is the main answer I was looking for. Because if you sneeze in your hands and then you have to touch doorknobs, light switches, touch anything after you've sneezed in your hands because you couldn't wash them, now you've spread those droplets and germs wherever you touched. I did mention in a previous class that obviously if you sneeze and you happen to be right in front of the sink and can immediately wash your hands, then great. But that's why you should kind of train yourself to avoid sneezing into your hands because you may not be able to wash them immediately. However, when you are available to wash your hands, make sure you wash your hands as much as you are often available to do so. And then make sure that you're washing your hands for at least 20 seconds when you are washing them. 20 seconds is about what they recommend for how long it takes to wash your hands properly. And I always like to say you can either count out 20 seconds, you can memorize some sort of 20-second monologue or quote, if counting out 20 seconds just seems like so tedious to you. Singing the happy birthday song or Twinkle Twinkle Little Star twice also equal about 20 seconds. Just finding a way that helps you make sure you're washing your hands long enough is very helpful. Additionally, avoid close contact with others. So avoid kissing, shaking hands, sharing cups and eating utensils. This is another one where lots of adults go, I don't share my cups or eating utensils with anyone. Why are you telling me this? Well, it's not until I ask them, how many times has your child or grandchild walked up to you, grabbed your cup out of your hand and put their mouth directly on your straw out of what you're drinking on? Usually that's when someone goes, oh, that didn't cross my mind. Exactly. So actively, these are things that adults are really good at avoiding with other adults. But again, children don't have the exact they don't think in the same way, like, oh, I'm not supposed to share that with someone. So you're more likely, if you are that potentially sharing cups and eating utensils with the child, a lot of times if your child's thirsty, you just hand them your cup, etc. So just thinking about that, avoiding those things, especially with one, either you or your child has RSV. And then last thing you can do to avoid is cleaning frequently touched surfaces. So again, I keep mentioning doorknobs, tabletops, crib rails, making sure those things are clean. But the one thing that I think a lot of people forget is cleaning your mobile devices. Our phones are always in our hands. They're in our pockets. We take them out. We put them on tabletops. We throw them in bags, etc. We're not sure what all of germs is catching. So making sure that you're cleaning mobile devices just as frequently as you're thinking to clean tabletops and doorknobs, etc. Okay, so now I'm going to switch to a video to show what we call a vampire sneeze. So like we talked about covering your coughs and sneezes with your upper shirt sleeve, that term is actually called a vampire sneeze. They coined it vampire sneeze to bring it kind of a silly, fun way, especially to teach children how to cover their noses, and kids are more likely to listen to something silly than they're likely to just listen to you say, cover your mouth. So let me switch my screen so we can watch this silly video on vampire sneezes. Oops. It's telling me it's loading. Bridget, can you see it? Okay, I've never seen that message before. It said screen share loading.
Trained, but I am socially conscious. Greetings, I'm Count Gordon, and everybody is concerned about spreading disease and germs and viruses and bad news, and we won't go down that road anyway. But so the CDC and a few other organizations say that when you cough and sneeze and gag and whatever, you should cover up. So here we go. We're going to do it the vampire way, all right? So if you ever want to cough or sneeze, you do it the vampire way. Bela Lugosi showed us how to do this. You get your cape like this, okay? And you go, you see? Don't spread the germs. It all went right into my sleeve, into my cape. And you're saying, hey, wait a second, Gore. Why would I want to take my germs and put it on my sleeves and cape? Especially if I don't have a cape. Well, it's simply because of your germs and your clothes. And it's better on your clothes than in someone else's nose. So because they get put into the washing machine, it kills them and they go bye-bye. Okay, so let's try this again. Let's try without the cape. Here we go. Okay, you're kind of walking down the street here in the mall. Yes. Hi, mall. How you doing? And you're going, See? Everyone is much better off. Cough, sneeze, and cover the Concord Deval Vampire Way. Your public service announcement today.
Okay, yeah, again, just silly little video. Showed vampire sneezes. For some reason, that rhyme, it's better on your clothes than someone else's nose, I think is going to be permanently ingrained in my brain after teaching this class. But I hope everyone else kind of remembers. As I said, they created that obviously for children, because it's easier for children to remember things that are silly. They grab their attention. But I'm 33 years old, and I'm pretty sure that rhyme is going to be stuck in my head for the rest of my life now. So I guess it works on adults as well. Back to my slides. Trying to make them full screen. Thanks, Bridget. Okay. So like I had mentioned previously, it's important to clean frequently touched surfaces. But being aware that there are lots of dangers when using cleaning and cleaning products is involved. So there's potential for not good interactions when you mix certain kitchen or bath cleaning products. So the number one rule is to think about never mixing, because you don't know what might react when it comes to mixing cleaning products. Some specific examples are to not mix bleach and ammonia. The thing is about ammonia is that ammonia can be found in certain things you may not necessarily think about. So ammonia can be found in some glass and window cleaners. Ammonia is in urine. So this is an important thing to remember, because if you have pets or you have children, there could be urine in certain places. So you'd want to make sure not to use bleach to clean around areas where there's potential for urine. So not near cat litter boxes, not near diaper pails. But also, I mean, if you have pets, there could be surprises if they went and accidentally peed in the house. So you're just being aware of that. Ammonia can also be found in interior or exterior paints. And that's important because if you're cleaning with bleach on certain like furniture that was painted, you might be potentially could be cleaning bleach, using bleach on something that might have been painted with something that has ammonia in it. Next thing to avoid is mixing bleach with acids. Acids are also found in a variety of things, like vinegar. Vinegar is a common product that people use to clean kitchens because it's food safe. But if you accidentally mix vinegar and bleach, that could be dangerous. Glass and window cleaners could have acids in them, dishwasher detergents, and some just store-bought cleaners may have acids. Just making sure you're reading ingredient lists of any cleaning products that you're using. Some additional do not mix suggestions. Don't mix baking soda and vinegar. However, we recently dived into this, and baking soda and vinegar can cause, it builds up pressure and bubbles up. It could cause an explosion. So the safety issue here is to not mix baking soda and vinegar in a closed container. So don't put it in a bottle. Don't put it in something that has a lid because it will bubble up and explode. However, if you put baking soda on a table and then put vinegar on top of it, it will bubble. But if it's an open space, it's not gonna cause as much of an issue. So just don't mix it into a container with a lid. These other two, we're not sure why the CDC do not list that I used for this training said do not mix bleach and rubbing alcohol, do not mix hydrogen peroxide and vinegar. I assume the hydrogen peroxide and vinegar probably also bubbles up just because hydrogen peroxide can bubble up on certain things. But some things to be aware of and not avoid. If you ever are curious because you like to clean things with more than one product, you can always go to Google and try to find additional information on why you should mix certain things. You don't want to accidentally cause a reaction that you weren't aware of. Some things could be deadly. Mixing of certain products could lead to like gases and stuff that could potentially make you pass out, and those things are really dangerous. So just being aware and making sure that you do additional research into what is safe and what's not. If you're ever questioning it, just don't do it. Just use one product at a time. Just some last points to make about trying to prevent the spread of RSV. Is that people with cold-like symptoms should not interact with children that are at a higher risk for severe RSV disease. So people who have cold-like symptoms should avoid premature infants, children younger than 2 with chronic or lung heart diseases, children with weakened immune systems, or children with neuromuscular diseases. And parents of children who are at a higher risk for developing severe RSV disease should limit the time those children spend in childcare settings or other potentially contagious settings, especially during high periods of RSV activity. Daycare settings are an easy place for diseases to spread because, again, children don't quite understand the importance of covering their mouths, so they're going to cough and sneeze outward towards everyone around them. So just being aware of that. We have now reached our first 10-minute break. So are there any questions about RSV or the chain of infection, or anything we've gone over in this first part of today's class?
I have a question.
Go ahead.
So what if a child who has, say, lung cancer Could that be a part of effect if she can get RSV? Is it like easy for her to catch it because she has lung cancer? Or not so much? It's just everything else that we went over.
That's not gonna change her
I mean, I'm sorry,
like-
sorry, not lung cancer, liver cancer. My bad.
liver cancer. Yeah.
Yeah, liver
It's probably
cancer.
not gonna change her regarding is it easier to catch, but with liver cancer, because cancer in general tends to lower someone's immunity. If they do catch RSV, they're probably going to be more likely to have worse, more severe symptoms, potentially leading to more severe potential hospitalization, etc. RSV, because it's like a cold-like kind of disease, is pretty easily spreads anyway. Like I mentioned, everyone gets it before the age of 2 because it just kind of spreads. But the problem with a child who has cancer, if they do get it, they're more likely to have more severe some symptoms from it than even if it was the same age. So it could be a 4-year-old with cancer, but a 4-year-old who's completely healthy, no undergoing any sort of treatments for cancer, etc. Though even though they're the same age, they probably one's going to have more severe symptoms than the other, very likely. So
Okay.
I would avoid anyone who potentially has any sort of cold-like symptoms being around that child if they are undergoing treatment for and battling cancer.
Oh, okay. Thank you.
You're welcome. Any other questions before we go to break?
I have a question here.
Go ahead.
If a child already had RSV, are they able to still get it again later on?
Yes. Yeah, unfortunately it doesn't keep you from getting it again, but it does build your antibodies in your body already. So your body will have the antibodies it needs to kind of fight the virus a second time, but it doesn't really stop you from getting it again. Although it's likely that if they were to catch it again, their symptoms probably are going to be more mild just because they already have the antibodies in their body to be able to fight it. Any other questions? You're welcome. Any other questions before we take our break?
Nothing in the chat.
Thank you, Bridget.
Hello.
Go ahead.
Oh yeah, this is Theodora. I had a confusion. It's not about the RSV or anything, but I have a question because the timing it started was at 1. It's at 1 p.m. Mountain Standard Time, and you guys started on daylight savings time, so I kind of missed out on the portion of the beginning of the session here that you guys are having. So there's a mix-up on time. I think that's why, because I just barely joined in 30 minutes ago, but the timing is like it says Mountain Standard Time, and the other one doesn't say daylight savings time, but I think you guys started on daylight savings time. Just saying.
Okay. Are you in Arizona?
Yes.
Yeah, we usually let Valerie's in Arizona. Those of us here in New Mexico get confused with that time time change. But we did record it, so Valerie can get you the recording so you can watch the part that you missed.
Okay. That's it.
For anyone that came late, we're seeing a couple of people from California joining in the chat. We can get you the recording also so that you can watch whatever you missed since you joined late due to the time difference. Okay, so now we're gonna take our 10-minute break. My clock is saying 2:02 Mountain Time, so we'll come back at 2:12. You're welcome. We ask that you do stay connected to the Zoom, but you're welcome to turn your camera off, mute yourself, etc. Go grab a snack, come back at 2:12 p.m. Mountain Time. Okay, welcome back. I hope everyone had a great little 10-minute break. We are now going to go into monkeypox. Perfect, thank you. So first, on some history of monkeypox, the first identified case of monkeypox was in 1958 among laboratory monkeys in Denmark. And then the first human case was recorded in 1970. This is a human case within the world. The first human case in the United States was in 2003. And the source of that first human case in the United States was determined to be prairie dogs who were likely infected by being shipped and stored next to Gambian pouch rats. I do not know what a Gambian pouch rat is, and that is probably because the US banned their importation of Gambian pouch rats in 2003, and they continue to be banned because they didn't want them to continue to infect other animals here in the US. These numbers are a little old, but as of May 2022, the US had 26,384 cases of monkeypox, and then there were 81,188 cases globally since May of 2022. These numbers are from May because that was around the time that I put this training together. So I had mentioned this previously in the chain of infection that monkeypox is a virus that can be transmitted to humans from animals. So primates and other rodents, etc., can potentially infect humans with monkeypox. But here's a little pop quiz to see who remembers what I mentioned in the chain of infection about animal reservoirs. What is the term used to describe a type of virus that can be transmitted from animals to humans? So monkeypox is this kind of virus where humans can get monkeypox from animals. There was a term that I mentioned in the chain of infection section that describes when animal reservoirs transmit diseases to humans. Who remembers what that word is? Zoonotic. Close. You're very close. It does start with zoo, though. So the word is zoonosis. So zoonotic was very, very close. Zoonosis. So zoonosis diseases are diseases that can be transmitted from an animal reservoir to a human. So monkeypox is a zoonosis disease because it can be transmitted from rodents and primates to humans. The second part here on the slide is a test question. Monkeypox is in the same family of viruses as smallpox, but is not related to chickenpox. Again, that was a test question. So yeah, monkeypox is related to smallpox, but not related to chickenpox. Chickenpox is a different set of viruses. So various animal species have been identified as natural hosts of the monkeypox virus, including but not limited to rope squirrels, tree squirrels, those Gambian pouch rats that the US banned in 2003, dormice, non-human primates, and other rodent and primate species. So for the most case, most people are not going to run into primates unless you work at a zoo or work with animals. But squirrels and mice are very common in both New Mexico, Arizona. I'm not sure about California how common they are, but most of us that live in New Mexico, Arizona might live in more rural areas that tend to have a lot of squirrels and mice. So that is a potential for carrying monkeypox there. So, let's go into more details about what monkeypox actually is. One of the first things that's a positive that I see as a positive for an illness anyway, is that monkeypox is rarely fatal. However, it can be fatal, it's just rarely fatal. So there is about a 3 to 6% ratio of monkeypox cases that do become fatal. And unfortunately, though, the highest number of fatal cases of monkeypox in total, both globally and in the United States, unfortunately, were young children. So very young children are more susceptible to potential case leading to become a fatal case of monkeypox if they catch monkeypox. So this is another thing where I'd be probably careful trying to avoid a young child catching monkeypox. Symptoms usually appear within 6 to 13 days after exposure, but it can take up to 21 days. So this shows that monkeypox has potentially a long incubation period, because it can be anywhere from 6 to 21 days after you were exposed to monkeypox before you start showing symptoms if you caught monkeypox. But the infection can be divided into 2 periods. The first is called the invasion period, and this is between 0 to 5 days. And then the second period is the skin eruption period, and this is 1 to 3 days after the appearance of a fever. However, the total cycle of monkeypox illness is about 2 to 4 weeks from start to finish, up to 2 to 4 weeks of running its full course. Oops, sorry. Again, unfortunately, those more severe cases, if someone does have a more severe case of monkeypox, does tend to occur among young children. So let's break it down a little bit more into detail, the 2 separate periods of monkeypox symptoms. Again, the first period is the invasion period, and this is 0 to 5 days, where you're going to experience symptoms including fever, intense headache, muscle aches, swollen lymph nodes, and exhaustion. And then the second period, the skin eruption period, happens 1 to 3 days after the fever first appears. And the most common symptoms in the skin eruption period of monkeypox is a concentrated rash on face, hands, and feet. However, there is also potential for a rash on the inside of your cheeks, inside of your lips, on genitalia, and inner eyelids. Those are less common of rashes, but are rashes that could occur. Okay, gotta switch my screen again because we're now gonna watch a video that kind of describes and shows you the stages of the monkeypox rash, because they kind of go in a stage that you can actually visibly see the stages of how the rashes are changing over time. And it also gives you, I know it's a little bit gross, but it helps you kind of get an idea of what that looks like and what you can look out for potentially if you see someone that has a rash that looks similar to the video. So let me bring that up.
Once we go past the pre-eruptive stage, we go into the eruptive or exanthem stage. This is the stage involving the rash. So the rash erupts. So skin rash is going to be the finding in this stage. So again, remember that the skin rash occurs about 1 to 4 days after the onset of those symptoms we talked about before. So we could see a fever, and then 1 to 4 days later, we can start to see the rash. And that's going to be important because with monkeypox, fever comes first, then the rash. So fever, then the rash. So again, the skin rash is going to occur within 1 to 4 days of the fever onset, but in some cases, it could be up to 10 days after the fever onset. And then with this rash, the rash is going to begin on the oral mucosa, so inside the mouth and on the tongue, we're going to see this rash occurring, and then it's going to spread to the face and other areas of the body. Some of these areas include the trunk, so we can see it on the chest and the back, the extremities, so the arms and the legs, and the scalp of the head. You can also see it on the palms and soles of the feet. So we can see in this image here, here are the palms of the hands being affected with this rash. And what's important about the more recent cases of monkeypox is that in more recent cases, which have had increased human-to-human transmission, the skin lesions are appearing first in the perianal and genital areas. So this is more common in the more recent cases. This particular skin rash is considered a vesicular or a vesicopustular rash, and we're going to talk about why that is in the next slide. And the lesions are anywhere from 3 to 15 millimeters in diameter. They are well circumscribed, meaning that the skin involving the rash and the surrounding skin are well demarcated. There can be anywhere from few lesions up to thousands of lesions, and they're often going to be centrifugally concentrated, especially if the rash is generalized. So if it's all throughout the whole body, most of the lesions are going to be on the center of the body, so the trunk area as opposed to the extremities. And these lesions develop in stages over the course of 14 to 21 days. And each part of the body will often erupt with skin lesions at different times, but they will all go through the same stage, and we're going to talk about that in the next slide. So what happens with the skin rash is that, as we mentioned before, it goes through particular stages. So after the rash occurs within the mouth, so in the oral mucosa and the tongue, it will then lead to a skin rash. And that rash is going to start out with macules and papules. So macules are going to be flat skin lesions that are less than 10 millimeters in diameter, and papules are going to be raised skin lesions less than 10 millimeters in diameter. So it starts out again with macules, these flat skin lesions, and it takes a couple days before they start to raise into papules, and then another 1 to 2 days after the papules to turn into vesicles. So vesicles are going to be fluid-filled raised skin lesions, fluid-filled with a clear fluid. And after 1 to 2 days as vesicles, they become pustules, and pustules are going to be raised skin lesions with opaque fluid in them. So it's going to look like a white fluid, so it can be pus filled, and this is why they're called pustules, and they can often resemble pimples. And they will stay pustules for 5 to 7 days, but during those 5 to 7 days, they can often change their appearance. They can undergo what we call umbilication. Umbilication is when there is a central dot that occurs on the skin lesion. So umbilication comes from the word umbilicus, and umbilicus means a belly button. And essentially what that means is that the skin lesions develop a little belly button. So they get this little central depression in the skin lesion. And then afterwards, they start to diminish and they start to crust. And then over time, they will start to desquamate. So desquamate meaning that they will start to peel off. They will start to shed. So this stage of scabbing, so the crusting and the desquamation, can take another 7 to 14 days. So from the beginning of the macules and papules all the way to the end